Hello, good afternoon. We're going to give it a few minutes for people to join us. Okay, I think we'll go ahead and get started as folks continue to hop on. Good afternoon or good morning. It is wonderful to be with everyone today. Thank you so much for making the time out of your day to join us for this webinar on making supportive housing work in rural areas. I'm just going to share a little bit about what motivated this work and what you can expect from this webinar before we get right to it. So my name is Nicole Dubois. I'm a senior research analyst and coordinator at the National Alliance to End Homelessness. And in this role, I've had the honor of working with research teams through our Research into Action initiative. If you haven't heard of it yet, the Alliance's goal with this project was to generate evidence that helps improve service delivery and shape smart public policy. And particularly in the focus areas of responding to unsheltered homelessness and improving the effectiveness of permanent supportive housing. This webinar today is the fourth in our Research into Action series, and I'll drop a link to our website in a little bit where you can learn more about this project if you're interested. So today, although homelessness is often portrayed as a crisis of cities, it has been a persistent and even growing challenge in America's small towns, suburbs, and rural places. Housing and services capacity tends to be especially constrained in these areas and more heavily reliant on federal funding. Faced with this reality, there is an urgent need to increase the availability of permanent supportive housing, or PSH, as you'll probably hear us refer to it today, and other interventions that are proven to end homelessness. So within this context, a team at the Housing Initiative at Penn set out to investigate the challenges and opportunities of establishing and operating PSH in rural America. And as you will hear, their research helps point us towards ways that states and localities are really innovating in this space and how policies can help more places scale up housing and services to meet local needs. So in our webinar, first, Cypress from the Housing Initiative at Penn will share much more detail about their really exciting study, which was really the catalyst of what brings all of us together today. Their presentation will be followed by a really exciting case example of Tawikan, a 42-unit PSH development in rural Colorado that opened at the end of 2024 as a product of a lot of hard work and some really incredible local partnerships that is now fully leased up. Kelly Willis, the director of the Pinion Project Family Resource Center, will share more about this project's history, the work that made it possible, and the impact that it's having on the community. Mr. Alston Turtle, council member of the Ute Mountain Ute Tribe, is unfortunately unable to join us in this webinar today, but we're very grateful to him for his partnership in this work, and we hope that there will be a future opportunity to hear from him. We'll conclude with a panel discussion during which we'll be joined by Jonathan from the Housing Assistance Council and Zach from the Colorado Department of Local Affairs Office of Homeless Initiatives. During that time, we'll talk more about the national context and where the field is going next. I did want to add one programming note before we get started. We understand that HUD's recently released FY26 Continuum of Care Program NOFO may be on many of your minds right now. But in this webinar, we're going to focus on describing what PSH looks like in rural areas and what its significance is to these communities. And I would point you to the fact that the Alliance will be hosting a webinar on the NOFO next Wednesday, June 10th, that will provide a detailed analysis of it and an overview of how we're responding. So I can drop the registration link to that in the chat as well. And we ask that you hold any questions related to that for that particular webinar. Speaking of questions, we'll definitely have a lot of time for questions from the audience. So as you think of them, please do add them to the Q&A box. And many thanks to people who already submitted questions as part of their registration. We made note of those and hope to get to them during the Q&A. And so thank you very much. And at this point, I will stop sharing my screen and invite Cypress to take it away.
Hi, everyone. Nicole, thank you so much for that introduction. Just give me a second to share screen. Mm. All right. Can everyone see that? Cool. I'm just going to go ahead. So today I'll be presenting on our report, Making Permanent Supportive Housing Work in Rural America. This is work I did alongside my colleague, Matthew Fowle, and with the support of the Alliance, and specifically of Nicole and Joy there. It was a real pleasure to work with them. So I'm based at the Housing Initiative at Penn. We're a small team that works to realize more effective and equitable housing policy at the local, state, and national level. We do this by conducting rigorous research to advance evidence-based policy making, often partnering with government and other key stakeholders. So as I said up top, today I'll be talking about our report on rural PSH. I'll start by giving a little bit of background, talking through our research approach, the geography of rural homelessness, barriers to implementation, and strategies for implementation. Um, so rural homelessness and homelessness response, as Nicole touched on in her introduction, in recent years, homelessness has been increasing. In 2024, over 120,000 people in rural continuums of care were identified as experiencing homelessness. Some 40% of these were experiencing unsheltered homelessness. Given this context, right, a robust response is needed to meet the needs of this population. PSH is a proven intervention, but little is known about how it functions in rural areas. So, our report and what I'm presenting today seeks to really understand three things. The first is, what role does PSH play in rural homelessness response? The second is, what barriers exist to implementing permanent supportive housing in these areas? And third, right, is what strategies have emerged to overcome some of these barriers. So to do this, we sort of took two primary approaches. The first was conducting stakeholder interviews. My colleague Matt and I conducted 45 semi-structured interviews with COC leads, technical assistance providers, policy experts, nonprofit developers, homelessness service providers, between February 2024 and March 2025, just to give a little bit of context there. And our interviewees came from 31 rural COCs across 26 states. We also pulled on public reporting data, including the American Community Survey, the point in time count, housing inventory count figures, other publicly available HUD data. And our analyses included COCs classified as rural or largely rural by HUD, that coordinate services across the 50 states. To do some of our analyses, we built a COC to census track crosswalk. This is available through our GitHub, and I'll share it in the chat after I'm done presenting. Um, so the report is really was like a multi-year endeavor, right? And so today I'm really just going to be scratching the surface of our findings, but um, to sort of give us a roadmap of what I'll be talking about today. On average, right, rural areas have lower rates of documented homelessness, um, and less robust homelessness response systems compared to urban and suburban areas, and also fewer PSH beds compared to these areas. There's constrained capacity in many rural areas of local organizations, along with a dispersed, like a lack of density, both in terms of people, but also housing and services. And these things together really can impact the ability of communities to develop permanent supportive housing, administer subsidies, and provide supportive services. And then finally, right, PSH in rural communities can be supported um, in a variety of ways by federal, state, and local governments, as well as by research and philanthropic partners. So this is the geography of the rural continuums of care, right? So our analysis focused on 108 non-territorial, largely rural COCs, and the map depicts these areas in yellow. I think what is immediately apparent, right, is that this covers most of the country. So 35% of the land, right, across the country has services coordinated by these largely rural COCs, and 30% of the total population lives in these areas. Um, and so here we've pulled some just basic numbers about uh, the total number of people experiencing homelessness, the rate of homelessness, the percent of this population identified as chronically homeless, the availability of shelter beds, and the proportion of those beds that are PSH. And I think I want you to take really two or maybe three things away from this. Um, the first is about the total number of people experiencing homelessness. I th we've listed the median, right? So the midpoint in terms of the number of people in each of this like type of COCs, but also the range. And what we see right here for these largely rural COCs is the number of people sort of picked up in their point in time counts varies from 56 at the low end to over 10,000 at the high end. So really just there's a tremendous range in terms of what we're even talking about here. Um, and we also see this in terms of the rate per 10,000 people. Um, but that the sort of midpoint there is right. It's significantly less than the urban COCs, but it looks pretty similar to largely suburban COCs, right? And so there is a real it's a real problem in these areas. Um, Similarly, right, there are fewer shelter beds, but even more noteworthy, there are fewer of these shelter beds that are PSH specifically. Um, And so, okay, what are the barriers to implementation? As I talked about up top, right, really we found these two overarching themes repeatedly arose: organizational capacity, which we talk about, right, as staff time and expertise, the sort of relationships an organization has with other organizations, the sort of like funds and access. To resources generally, and then density, the sort of extent to which people are spread out. And these dynamics right together sort of play out as communities seek the startup capital necessary to establish permanent supportive housing, and as providers administer ongoing subsidies and deliver supportive services. Um, so here is a quote that I think from our interview work that does a really nice job of illustrating this, right? Which is that in some of these rural continuums of care, planning grants, that amount of funds is less like equal to less than one full-time staff person, and yet the COC is still like expected to carry out many of the same responsibilities related to creating a homelessness response system, right? So um, they're still doing the pit count, training, capacity building, applying for and maintaining funding, ensuring that various parties right throughout the COC have the support they need. Um, so this like these issues of density and capacity sort of like join together, right? And make it harder to document chronic homelessness and build support for PSH as an intervention. In the first place, something we heard again and again in our interviews is that homelessness is often less visible in rural communities. Um, and then that undercounts of chronic homelessness really can erode community support for establishing PSH. Um, right, there are some parts of continuums of cares where even if there are services provided, they're not integrated with the continuum of care system. Um, Street outreach like necessarily looks really different in these areas and is much more resource intensive. And so there are people who are experiencing homelessness who are really just like not getting documented in this in the system. And on the one hand, and then also community members can have a less like acute sense of the problem in comparison to urban um, communities. Um, Uh, Many rural communities also face problems around the cost and scale of developing purpose-built PSH, right? So high capital requirements make single-site PSH projects difficult in rural areas. Um, the scale of the number of units that are needed can really stop there being like economies of scale. So developing PSH that's really like at the correct level or at the correct scale is out of reach for many communities. And then underdeveloped organizational capacity also often limits access to funding, right? So as I talked about before, right, the sort of handful of staff often really struggle to coordinate homelessness response and carry out those key functions. Uh, while in larger continuums of care, there might be designated grant writers. Those things are less common outs in rural continuums of care, making accessing funding really difficult. Um, right. And so like partially as a result of that, a lot of what we see in rural communities is scattered site PSH, but administering those subsidies, even when they're in place, can pose serious challenges. Something that we heard over and over, right, is that rental markets are really tight, and that it's really difficult to find units for clients, and that this difficulty can create real delays in placing tenants into PSH. Um, and that the restrictions on how subsidies are used can further limit the pool of potential units, right? Something like 1 in 3 rental units in rural areas are over 50 years old. So there's housing quality issues here, among others. There's also barriers in rural communities to providing supportive services. Um, there's right just fewer services in these areas, or those things are further apart, and there's like limited public transportation options, which can make it really hard to ensure that clients are like receiving those wraparound services that we think of when we were talking about PSH. Um, And then, right, like delivering those services on the other hand becomes really time intensive and resource intensive. This was a quote where, as I was doing the interview, it was just felt like it was put such a fine point on it. The scattered sites are more scattered, so the time and energy it takes for a case manager to successfully bill all their clients is larger, right? Whereas in the city, you might be able to hit 10 or 12 clients in one apartment building. In a rural community, there might be a couple of places, but the complexes are just much more spread out. And so, right, it becomes harder to deliver these services. And this can compromise the frequency and quality of service delivery, especially case management. I also just want to flag here that something else we did hear right during interviews is that um, because it can be really hard for folks to access services or there's fewer services, individual case managers or service providers or will end up filling many roles, and that is just like a tremendous commitment of time and resources. and that the PSH becomes like sort of a one-stop shop for many different services. Whereas, right, in a more urban area where there's greater density of services, there might be more partnerships and different people taking on different roles. Um, so, okay, what are strategies for supporting implementation of PSH in rural areas? Uh, we sort of broke this down into three things, right? Providing flexible and long-term funding to address rural homelessness, right? Target funding, so it's really covering the costs associated with implementing PSH in these communities. Um, we see, right, some state governments expanding funding opportunities for PSH and ensuring that these funds are accessible to rural communities. Um, Reducing administrative requirements necessary to obtain and maintain funding is also really essential here, right? Um, because there's lower capacity, the sort of annual grant application and process just takes a lot more from a smaller organization. And so finding ways to reduce the amount of friction involved in accessing funds um, and maintaining compliance, particularly for those local level providers, can really like help unlock capacity. And finally, creating evidence and providing support for rural PSH. Um, there's like little evidence on rural PSH program models specifically, um, and opportunities for peer learning and support, as well as technical assistance, should be sustained and expanded. And I'm going to end here just with two examples of efforts that sort of aim to sort of close the gap on some of these things, right? So in 2022, HUD issued a special notice of funding opportunity. I imagine that most people on this call are familiar with this, right? But that these funds and it included funds designated specifically for rural communities. These had like a larger or a longer were longer term grants, 3 to 5 years, had alternative documentation requirements that provided greater flexibility and could be used to cover a diverse set of expenses, including repairs to make PSH habitable, um, to really like again just like close the gap on some of what it actually looks like to be implementing PSH specifically in rural communities. And then the second example, right, is that the Nevada state legislature established a supportive housing development fund, um, really aimed at supporting people with complex barriers to housing. This fund offers grants for supportive services that can be paired with housing finance tools. Um, so does some of that braiding internally, provides options for 5-year grants, provides bridge funding for supportive services, and set asides to do some of this capacity building. Um, and I think I'm going to end there because we have such a great panel here. But again, this really just scrapes the surface of what we found in the report. And I'm going to hand it off. Thank you all so much.
Thank you, Cypress. I'm sure folks have several questions about their research, so please add those in the Q&A, and we will have more time with Cypress later. Kelly, I'll invite you to come on camera and share your screen. Thank you.
Give me a minute here as well. Sure. Well, yeah. Can you all see that?
We can see the full PowerPoint, not the presentation view, but that's also fine if that's what's working.
Great. I'll just move along with this. And I doubt people want to see my technical challenges. So, um, I am Kelly Willis. I'm the executive director at the Pinion Project Family Resource Center. I just wanted to really show a concrete example of what we were able to develop in September of 2024, permanent supportive housing for our very rural community. We're a community of 26,000 folks that really incorporates three small towns as well as the Ute Mountain Ute Reservation is part of our county. So, um, with the partnership of many people over many years, what we learned, we are a service provider. We are definitely up until the development of this project. We had zero experience in housing. We had a great need for housing in our community. We serve around 3,000 folks a year through our agency. We have 20 to 30 grant funded, foundation funded programs per year that range everything from early childhood youth services, family services, emergency services, reentry services, homeless prevention services. We are one of the primary homeless prevention providers in our county as well. So we have discovered we've been in our community for 30 plus years, and what we have learned over those 30 plus years is that many of our folks, if they could find housing in a very limited housing inventory market, they either couldn't afford housing, they couldn't, there were so many barriers, including criminal background, credit background, everything that you were all already familiar with. And so what we saw, we were expending many hundreds of thousands of dollars a year on emergency assistance as dollars. And so we started about 10 years ago looking at how we could make some of our families more successful in really limiting evictions, access to um, access to housing and all of those sorts of things. So what we did was partner a few years ago with um, we partnered with a development company and were able to have some really great expertise in developing a 42 unit permanent supportive housing project here in Cortez. We partnered with a development company and many people at the state to take care of the capital needs for developing this, what you're seeing as this 42 unit of mixed housing. And we're able to decrease our by name list. We also administer the by name list. But what I wanted to really talk about is, as you're seeing some of the pictures of what we were able to develop, was the importance of the services. We are the lead service provider in our project. We were able to leverage not only our ability to provide service within this housing and hopefully support many of the residents in the housing to avoid any kind of eviction, but we were able to also lower the barriers for people coming into housing. So we really focused on harm reduction models, but we are able to bring services into the building every day. We provide service, a self-sufficiency program 4 days a week. We have parenting classes. We have financial literacy classes. We have all of the strength of Pinion Project support classes that comes into the building to provide night classes. We have a 24-hour front desk staff that we have found incredibly helpful for most of the people that reside in the Tawikan apartments, as well as we've got 2 full-time case managers. All of our staff, we have a staff of 50 at Pinion Project, and most of our programs have a component of case management included. So that's, I think, has made the difference in our community, that has really allowed permanent supportive housing in a very real way. I think other communities, rural communities, may be constrained by the service provision. In affording this service provision is a challenge always, but many of our staff, we are funded under different programs, and we bring those staff into the building. So I think that in hindsight, that really has been the core to the permanent supportive housing in our community, is the ability to just bring services to the building at a capacity that we're able to provide that. Stop sharing that and ask what other questions that you would have for me, Miss Nicole.
Thank you so much. That was so wonderful to see the building too and to hear more about that. Thank you so much for sharing. I will now invite all of our panelists to come on camera. We can start the official Q&A part of our webinar. Unfortunately, it seems as though Jonathan is having technical difficulties today and won't be able to join us unless something a miracle happens with Zoom. So maybe we'll have another panelist. But if not, we'll just go ahead and get started. And since we haven't met you yet, Zach, could you please introduce yourself and your work and how that's related to the development and sustainability of PSH in Colorado?
Absolutely. No, thank you so much for having me. My name is Zach Schaffner. My pronouns are he, him. I am the Community Partnership and Development Manager for the Colorado Department of Local Affairs Division of Housing. And so we at the Division of Housing, we play a couple of roles relevant to the world of permanent supportive housing. We're a public housing authority, so we have an allocation of vouchers from HUD. We are a gap funder and financer of affordable housing. So we put grants and loans into the creation of permanent supportive housing. In the example of Tawi Khan, right, we provided gap funding for that program. We also provided vouchers. In the case of Tawi Khan, we provided state housing vouchers, which we're very fortunate to have in Colorado. Our state housing voucher program, which follows the federal housing choice voucher program, but has some exceptions around eligibility and is intended really as a subsidy specific to permanent supportive housing. And I feel very fortunate. My role in Colorado is to help create high quality permanent supportive housing. We do that through the technical assistance we provide through the Office of Rental Assistance, the Office of Homeless Initiatives. We work closely with our Office of Rental Assistance and with our Office of Housing Finance and Sustainability. So really our goal at OHI is to create a robust continuum that ensures that everyone has a safe, stable place to call home. And permanent supportive housing is an essential component of that continuum. So we work really hard to create as many Tawi Khans and other outstanding permanent supportive housing projects across Colorado as we can. Creating those projects in rural communities has its own special set of challenges, but also incredible opportunities. And that was a very long introduction, so I'll pause there.
Thank you. In the registration for the webinar, we had several people ask about services and how you make services work in rural PSH specifically. I know, Cypress, you highlighted some of the challenges that you heard about in your research. I don't know if there's anything that you wanted to add on that front. Kelly, also, I know that you talked a little bit about what the services look like, if there's anything else that you would want to add as well in terms of recommendations for other PSH projects. And then, of course, Zach, feel free to jump in on this one as well.
I think for us, when we spent many years trying to look at what a solution for housing in our community was, the service piece was not a barrier for us because we are a fairly large for our community or for our region. We're a large service provider. So we have the benefit of having many services funded outside of the PSH um, housing. We draw on other programs and take those programs into the building. So I think that it would be very challenging as a service provider if we only provided one program and we had to look for funding to sustain service provision. That was not an issue with us. We also have funding that comes. Mr. Zach and the state are very helpful in providing tenant support service dollars for our permanent supportive housing in Colorado. That's helpful in that we have front desk staff that pays for. But I just really feel like the service provision for TawiCon is successful because we're a large organization coming in with already made and experienced services and case managers. Every one of our folks that come into the building is a case manager in addition to whatever other service they're providing. So I think that's what has made us successful in the service provision area.
I think what I'd add that we talk about in the report is this something we heard both from like COC leads and individual providers was about sort of slowly developing capacity over time. So maybe first applying right for a smaller, less technical grant and using that as a way of building out capacity and or of like bringing providers that have been operating outside of the COC system in more to integrate them into it. Um, So rather than thinking of it as sort of like a small organization suddenly taking on this really complex intervention, um, seeing it more as a process of expanding services and capacity.
And likely leveraging, sorry, Zach, leveraging relationships. I would say, with Zach, we've had a relationship with Zach Pinion has for many, many years, but we have relationships across the state. We have relationships regionally, locally. And so we're definitely not the service provision in permanent supportive housing, but we rely on a lot of people to come in and out of our building to connect those folks that live in our building with services. And we have very little treatment in our community. So we connect with folks in the metro area in Colorado to send our tenants to the metro area to get what they need for treatment services, that sort of thing. So I think it's widening your net and your relationships is very important as well.
Yeah, and just to that, I might use the term piecemeal, right? When you are creating a permanent supportive housing development, you're trying to leverage every source of supportive services, funding, and capacity that exists. So in Colorado, right, we rely heavily on the organizations formerly called community mental health centers, now comprehensive social safety net providers. Um, so, but often in Colorado in particular, the supportive services are the most difficult things to fund, right? We've really figured out the development funding leveraging our low income housing tax credits. We've figured out the operating expenses through dedicated project-based vouchers, whether they're state or federally funded. The services have been the missing piece. And they're the most challenging, and they're also the most important, right? If you don't have those type of wraparound, robust services, you can't maintain housing stability. You really have to have those flexible services. I often say, right, it's not a question of if it will happen, but when it will happen with some of the big behaviors from our residents. It's a question of how we respond to them in a way that's trauma informed and informed by best practice. And so in order to do that, you have to have robust services. And so that's why in Colorado, the state has stepped in and we are investing dollars in tenancy support services, the TSS program Kelly described. The challenge is, every dollar we spend on supportive services is a dollar we aren't spending on rental assistance or development funding. And so that's where we're really trying to leverage every dollar we can from our state Medicaid program to pay for supportive housing services. So that's been a challenge for us, is trying to, well, we need to be in the space of funding tenancy support services. They don't happen by accident. You have to invest in them. Um, and right, folks are doing the amazing work on the ground of scraping it together and making it work. But we have to states, and that's my perspective, need to invest in supportive housing services. We braid a lot of different funding sources together to create that program. But it's essential, and we need to move towards Medicaid, but we know that Medicaid maybe won't always be able to pay 100%. And so having those flexible dollars is really key. And that's where state and philanthropic funding can be a real asset.
You, Zach. And I think you teed up next great question, which is on the role of Medicaid in services. You started to talk about that. Can you say a little bit more about what Colorado is doing? And then if anyone wants to jump in after that, that would be great.
Sure. Yeah, I never expected to be the person who knew the most about Medicaid at a public housing authority agency. I don't think my colleagues expected it either. Um, so we in Colorado were very fortunate. We were able to get approval from CMS for an 1115 health related social needs, or HRSN waiver. So we have an 1115 waiver in Colorado. It's currently on the books. And what that's allowed us to do is that we can change the reimbursement for behavioral health services in supportive housing to be on a fee for service basis rather than going through our capitated reimbursement through our managed care entities. That sounds like a lot of gobbledygook. I fully understand that if you don't live and breathe in the world of Medicaid. But what that means is we are now playing a new role at Division of Housing where we are credentialing supportive housing. And we say, okay, for example, Tawi Khan, great project. We've got vouchers, we've got supportive service plan and budget, we got a low barrier tenant selection plan. It's permanent supportive housing. Great. We're going to give you a certification letter that you can then take to Medicaid, which allow you to bill Medicaid, and you can get a monthly and a daily and a 15-minute billing increment. Those amounts, I will say, are not sufficient. We are working with our healthcare policy financing agency on having discussions about those reimbursement rates, but that has been a really long-term goal, and it has been years in the works to create avenues for providers like Pinion Project, who are not clinical service providers, to be able to bill Medicaid for the supportive housing services that we know are essential.
Thank you. I'm sure maybe you'll invite some technical follow-up questions in the Q&A. Jonathan, I see that Zoom decided to cooperate and you're here now, which is wonderful. Could you introduce yourself and the work of your organization and how it relates to permanent supportive housing?
Yes, thanks. I hope everybody can hear me. I'm Jonathan Horowitz from the Housing Assistance Council, and I decided that what I would do was model the persistence that it takes to do permanent supportive housing. I am not a tech person, and something happened with Zoom, but I'm here. Hack is, and as you can see, I am calling in from a conference, and I'm in a hotel room, and it looks like I have a lampshade on my head because I'm going to be the life of this party. And HAC is a national intermediary focused 100% on rural housing. And I know that the sort of question that Nicole had teed up for me as we prepared for this is sort of to describe how the work of our organization relates to the topic of the webinar. And I will say that I am our director of policy. We do research, but most of our focus is on direct lending to affordable housing, technical assistance, and training. And the way I describe it is that any organization that is focused on housing has to be focused on homelessness. It happens to be the case that HAC has been recently quite active working together with the Alliance on Homelessness. We've had two rural homelessness summits at our last two biennial conferences. I personally have been very involved in permanent supportive housing throughout my career. Previously having been at the Corporation for Supportive Housing and on the Hill, working on the Hearth Act reauthorization of the homeless programs. But I think it's absolutely critical that sort of the mainstream housing organizations be focused on homelessness. I mean, I think our homeless system has been around so long that sometimes we forget that it is a reflection of the failure of the affordable housing system and the failure of our society to provide enough housing to prevent homelessness. So really pleased to be here. And I can tell you, I'm at the National Council of State Housing Agencies annual tax credit conference. And the conversations that I'm having with state HFAs and the conversations that we have with our partners, the challenges faced by rural permanent supportive housing and putting it together is really it's the same set of challenges that we find with all of the housing developer providers that we work with and that states find in trying to support them in rural areas, but even more, because of the layering on of the services and the challenges in funding that. So that's why I'm really glad to be here and to take part in this great panel.
Thank you, Jonathan. And thank you for joining us from a conference. I think maybe let's talk a little bit more about what the housing looks like in particular. Cypress provided an overview of what we know from nationally available data and the interviews that you all did about scattered site units versus site-based developments. Curious if Kelly or Zach want to chime in about your perspective on what the housing looks like often, and the impact that has on the success of the projects as a whole.
I can cue you up, Kelly, if that's all right. So my perspective and I will fully credit some of the partners from Boulder, Colorado, a great organization called All Roads, and their executive director and I were discussing permanent supportive housing. And because of the work I've done with single site permanent supportive housing, right? I'm like, okay, the benefits that Kelly described. You have controlled access. You have a single source of entry. You have the economies of scale. You have so many benefits. But if we really want to be responsive to the needs of individuals experiencing homelessness, we have to have a continuum. Some individuals are not going to be interested in a single site permanent supportive housing development. They really want to live in a unit with a tenant-based voucher. And I think we need to have resources that are responsive to that. So it's tough to secure landlords who are willing to serve an individual. I think you need to have very intentional tenant selection policies in place that differentiate between those different resources. But you need to have multiple types of interventions in order to meet the full continuum of need. And Kelly, I'm kind of curious from your perspective, have you seen that as well in who is successful and versus clients who say, this is not the right intervention for me?
Yeah, I think we're starting to see it now after folks have been in permanent supportive housing for a while. They are not keen on having people monitor their comings and goings, and they're ready as intended really to move on now into something else. I think the problem in our area, as in more rural areas, the limited inventory of housing and the landlords unwilling to really give people a shot, even when they've been in a permanent supportive housing situation for a while. The rents are still out of reach of many of our tenants that are ready to leave permanent supportive housing, and there are no vouchers available for them in the moment. So, we are seeing it now. It's not for everybody. Initially, it's great for most people that are in need of housing and have experienced a period of homelessness. And then it not everybody wants to stay for long periods of time, which is good.
Kelly, quick follow-up, and then Jonathan, please jump in. Someone had asked in the Q&A if you could describe who lives at Tawikon, specifically if you have families, including young children.
Yeah. So I would also say that that is has been a challenge because of the number of units, the cost, a lot of different the small county we live in. We have a mixed population. We have 42 units, and we've got 14 one bedroom, 14 two bedroom, and 14 three bedroom. It presents a challenge for mixed populations where we have many of our single folks were chronically homeless for many, many, many years. And it's very low barrier housing. So they came into housing, and not all of them were ready for sobriety. And we have untreated mental health. We have all of those things. And then we have families in addition coming in very different situations where a lot of times many of our families are single moms with multiple kids. And so trying to really mitigate some of those behaviors is a challenge as well. But we really, if we had numbers in terms of our demographics and population, I think a family housing, single housing in separate places would be a lot easier to manage.
Thank you. Jonathan, please go ahead.
Yeah, let me just, I just want to agree vehemently with what has just been said, and just, just add a couple of things. First of all, to talk about the housing, the tenants and the tenancy. I think the housing model, one of the realities is that we have an affordable housing finance system that greatly favors scale. It's hard to, much of the permanent supportive housing that first started, developed around the model that works for affordable housing more broadly, which is 25 units and up, and even better if it's 50 units. So it's been challenging to do the scattered site generally, but people really want it. And I just really want to echo that, to talk about the tenants. When tenants come in and they have acute needs, maybe untreated mental illness, not ready for sobriety, they greatly benefit and maybe highly willing to take part in the services, in order to have the housing. But after a period of time, it's, first of all, they don't want to be in that situation any longer, and frankly, they may be being over-serviced in the sense that there are other folks who could really take those slots. And I think it's really a challenge here, because many of us, certainly I did, came up sort of, I would say, opposing transitional housing, because we did not like the idea of an arbitrary end to the time that someone could have housing, and permanent should mean permanent. But I think the reality that we've been seeing, and I was just talking to people from the Kentucky Housing Finance Agency, where of course they invested heavily in recovery centers, and they've really seen this, that after a period of time, folks want and are ready for a more independent situation. And I think, we just cannot emphasize enough that we lack the continuum because we lack the resources. And that, if we have the opportunity to put more resources into the system, we know where it could really help the most here. And I think one of those places is where you have folks who are coming into single site permanent supportive housing, benefiting from the services, and we need an exit strategy that works for them, but needs to be resourced.
Thank you. Yes, definitely appreciate your point that it all comes back to the availability of a continuum of housing and services to really meet folks where they're at, when they're there, right? Your question about resources, or the point you were raising about the need for resources, brought to mind a question that we had gotten from one of the attendees prior to the webinar, who asked, where would targeted philanthropy be useful in developing rural PSH? And I'm curious if anyone has a thought on that.
Yeah, I can jump into that if that's okay. So, for example, we were very fortunate. We've had partnerships with Kaiser Permanente, where they've provided funding for our tenancy support services. So we're taking funding from Kaiser Permanente, SAMHSA funding together with funding, state funding, and we're using it for that tenancy support service program that helps programs like Tawi Khan. But when it comes, the real benefit of philanthropic funding is the flexibility that comes with it. And so, in my mind, I think that's well suited for acquisition funding, depending on the volume, right? It's difficult for state agencies to engage in land banking for how long do we sit on that property? What happens if it doesn't move forward? All of those sort of challenges. And then the other thing that we also really struggle with that I think is a great fit is pre-development funding. Putting together, I mean, Kelly, you know this well. Putting together Tawi Khan was a years-long process of pulling together different entities. We were very fortunate. We had technical assistance funding in partnership with the great folks at Bo Simone Consulting, who were able to provide some technical assistance to do that pre-development work. So because that just takes a lot of time to pull things together. But Kelly, can
Yeah.
you talk about that too?
Yeah, I think that consulting firm was paid out of some philanthropic money. Our land was purchased with state foundation, or a foundation in our state. That really got us off the ground with this project, as well as when we realized we had some gaps in funding that we needed. We have a really large foundation in Colorado that stepped in, and because obviously we were the nonprofit partner, so money flowed through us into the development. So it's amazingly important. And as a service provider, those flexible dollars to provide service is unmatched. We can do what we need to do with it without a lot of the state guidelines and structure. So important to have those partnerships.
Yeah, and I want to really echo this because Hack as a CDFI and technical assistance provider, um, we cannot have enough pre-development and acquisition funding to deploy. It's the most needed piece. Absolutely. The other thing I would just throw out there as well is things like security deposit, particularly if you're doing this kind of scattered site stuff, you can have landlords, if you have a good landlord outreach, they're going to want, some are going to want first, last, and security, especially if they're taking a challenging tenant, and that can be difficult for public agencies or individual strap nonprofits to come up with. So I would in some ways, that's the tenant-based equivalent of acquisition funding and pre-development, right? It's on spec. And so I think all of that is where the last thing I would just say is sort of first loss kind of things. It's basically, when you're a CDFI or others, if you're trying to prove that something that's perceived as risky isn't that risky, it's always great when you have philanthropy who's willing to step in and say, we'll encourage other investors by being first loss.
Thank you. Cypress, I'd love to turn to you and ask more from the research perspective, where you think it would be helpful for research to go from here after your study, and if you had any lingering questions that you would like to answer in the future.
Yeah, so our report, we really focused on understanding the landscape broadly in terms of right where PSH is, sort of what are the challenges generally. Um, what is missing, and this is sort of where we end the report, right, is like practice-oriented research and program models that have been evaluated that are developed for rural communities and maybe take some of those realities uh, in into account, right? So one thing that we talked about, right, was yeah, like going in and evaluating programs to understand where potential trade-offs might exist and what are really essential aspects of the intervention. Um, and then on the other hand, providing like hands-on technical assistance and opportunities for peer learning and support, which is going to be like less rigorous, but just to provide that sort of like real-time knowledge of what is happening, and that there's, I think, space, right, for research partners and philanthropic partners sort of on both of those fronts.
Nicole, can I jump in with one point here?
Yes, please.
Yeah, sorry, I can't see everybody. So I just wanted to mention, I think what Cypress was just mentioning is hugely helpful. But one thing I was thinking, um, there may even be existing research on this, but I think in particular, we've talked about the challenges in rural around distances and case managers traveling great distances. I think, the use of virtual support, particularly in the mental health space, and health, I think is worth exploring. Well, I'm sure it's already being explored, but being studied and sort of seeing, for which populations and which kinds of interventions, you can, uh, you know, save time and money that you don't have and not have to have someone physically traveling. There's sometimes where there's no substitute for that, but I think we're as a as an entire system, we're kind of figuring out, there's a giant experiment going on in terms of getting prescriptions and therapy and other things through that. I think, but in rural, where distance is such a challenge, I think that is worth some research.
I would also say that our experience with primary care, mental health care, behavioral health for the folks that we moved into our building initially, many of them, as I said, have been homeless for a long period of time. Our homeless prevention in our community includes a street outreach team that has street medicine team on it. And many of our folks weren't willing to do the telehealth that we provided in the building. They only felt comfortable with the street medicine team. So, as part of our weekly staffing of all folks in the building, the team that comes together is not only the staff that works in our building, but we have our behavioral health. Our traditional behavioral health provider, but we also have street medicine that comes in. And from the very first week that we were in the building, that became the primary provider for most care in our building because it was trusted people that the folks coming into our building already had a relationship. So I also, to your point of thinking outside the box and not just a very strictly prescribed what do services look like.
Thank you for sharing that information. I think that also just speaks to the importance of what Cypress was saying in terms of more practice-oriented research and getting some of these models out there. So if there are any researchers on the line, here's some ideas for you. And if anyone is doing research on any of these areas, please reach out to us. We would really love to hear about it. Speaking of models, I'd love to turn to the future and ask, moving forward, Zach and Kelly, where do you see your work with supportive housing going, or where would you hope that you might be able to grow into?
I think that's a really important question. But I have a pretty boring answer. Uh, it's about scale. Like we know that supportive housing is a best practice. We know it works. We've been very fortunate to increase the development of permanent supportive housing here in Colorado with our state resources, with the influx of federal resources during the pandemic. And we need more of what works, essentially. We need more permanent supportive housing. We need, again, so often the limitation is on the resources. We know it's effective. We just need to invest at the scale needed. I will say, I think we're very fortunate in Colorado. We have a better sense of the data than we've ever had. I'll share a link to it in the chat in just a second. We released for the second year in a row our State of Homelessness report, which captures the demand or it captures individuals who are engaging with our homeless management information system. We're very fortunate. We have a statewide HMIS system in Colorado. So it really shows the demand in a way that's far more comprehensive than a single point in time count. And it shows what we need is housing that meets the needs of our chronically homeless individuals. We just have to invest it in its scale. So I know it's a boring answer, but I want to hear from Kelly for sure.
Well, yes, exactly what Zach said. I think we have learned a lot over the last couple of years, what really works, and it truly does work. And it's capacity, it's all of those things. Especially in rural areas, I can see that our 42 units keep us hopping probably 25 hours a day. So the idea of expanding is we need more service providers on board. The capacity is really what we're at the moment. So, and money from Zach, I guess that's what we need.
Well, and agreed. And I'll also say, to your point, Kelly, we need more. We absolutely need more service providers in this space. We can't just have the same providers because it's about trust. Who an individual is willing to engage with, if they don't look like them, if they don't understand, if they're not providing culturally competent services, etc. So expanding the providers who are working with this population is really critical as well. We can't just have the same entities. That can't just be these clinical providers. We have to go in, create partnerships with folks who have real grassroots connections and critically trust with the population we're trying to serve.
Yes.
And let me just again vehemently support everything Zach and Kelly have just said, and just note again, this fits into a larger picture of the challenge faced by rural communities generally. But again, I happen to be at a state HFA tax credit conference, and the low income housing tax credit is a great tool. But its basic design is for 50 units and above, which is not inherently a rural thing. So state HFAs really have to work to have it work in rural, and that is true just across the board. Home and CDBG and programs like that. It's great if you're a participating jurisdiction or an entitlement community. If you're not, which most rural areas, and particularly the most remote rural areas, aren't, then you really need a state, to a state and more broadly the entire system to help address that imbalance. And not everybody's like Zach. We wish that they were. And Colorado is really showing what happens when a state really, gets it together. And as he says, he's quite modest, sort of saying, that they're lucky. Well, they didn't. They got to where they are by working really hard and aren't satisfied. So I want to make the point that we have a challenge more broadly. And in affordable housing, if you looked 50 years ago, when there really wasn't widespread homelessness, there was one major direct funder of affordable housing, and that was the federal government. We have changed that model to work through mixed finance and through entities like states and localities and nonprofits. And that setup means that rural communities are challenged, and they're challenged with capacity, and the entire system needs to work to redress that imbalance. So I want to locate it, within this broader point that there are benefits to this approach, but we really need capacity building. And the last thing I'll just say is the future is even better homelessness prevention. We focus very much at HAC on the USDA 515 portfolio, 400,000 units of folks, often the only affordable housing around, 2/3 elderly and disabled. We work to provide service coordination in those projects. Service coordination prevents the need for permanent supportive housing for people who have fallen into homelessness and their needs have become more acute. So, I think the future is providing service coordination in a much broader array of housing that is feeding the homelessness system, or at least feeding it much more rapidly in terms of people who would otherwise be able to stay stably housed for much longer.
Awesome. Thank you. You all raised quite a few policy-related implications in your answers, but I did just want to ask if there was anything else that we haven't mentioned yet that you think is important for policymakers to know about permanent supportive housing in rural areas.
I'll add one. In Colorado, we have a partnership between the Division of Housing, which is the Public Housing Authority, and GAP Funder with our tax credit allocation entity, the Colorado Housing and Finance Authority, or CHAFA, for the joint review of permanent supportive housing projects. And that has been really, really helpful in increasing the supply of supportive housing developments. And essentially what that means is if a project is applying for vouchers and tax credits, they don't end up with one and not the other. That is really disruptive. If you get half of what you need both. You need the rental subsidy, and you need the tax credits, and you need the funding for the supportive services and the everything else. So the more that funders can align those resources, in Colorado, we have a single RFA. It's called the PSH RFA. We've run it every year since 2014. It's been tremendously helpful in just making it easy for our applicants to apply for and create permanent supportive housing, because they don't end up with some of what they need, which is in some ways worse, right? They know that if they're going to, we're making a decision, we're consulting together between Division of Housing and CHAFA to make a joint decision and say, okay, we're the experts in services underwriting. We give this a thumbs up. They look at it from a financial perspective, more in depth, from a tax credit allocation perspective, and they say, okay, together we say, great, you're good to go. It's a complex project requiring conditional determinations and language like that. But our RFA has been really helpful, and it's something I would encourage other funders to look at, is trying to align those resources as best you can to make it easier.
Thank you. The magic of this work is very in the weeds and takes a lot of knowledge to bring this all together, and ways to streamline are always appreciated. Cypress, any thoughts on policy from your research perspective?
I think just going back to the sort of like heterogeneous nature of rural communities across the country, right? That things look really, really different in different places. And so, yeah, creating flexible models to sort of meet those realities.
Right. Unfortunately, we are out of time. I'm sure all of the panelists could continue talking for a while, and I'm apologize to the folks whose questions that we weren't able to get to. I'm now going to copy the links in the chat to the report. I think Cypress shared that earlier as well. The Alliance also wrote a brief summary of the report too, with some of our key takeaways. And then lastly, I dropped my email in the chat if anyone has any lingering questions that weren't asked or weren't answered today. But thank you so much to all the panelists, to all of our attendees. We really appreciate your time and attention on this really important topic and look forward to ongoing conversations in the future. Take care,
Thanks,
everyone.
Nicole. Thanks, everybody.
Thank
It was
you.
great.
Thanks
Thanks
all.
so much.